where should a stroke patient or somebody who has been stricken by a stroke, or for that matter, any other disease, where should they seek care? Where should they go and seek care? All right. So that is where we are. And you were saying something. You want to say it again?
I think you mentioned that some people will just rely on one and forget about the other. So some people will just spend their whole time in the prayer grounds, right? Praying for God to heal them and forget about the hospital. And some people may spend the whole time in the hospital forgetting about praying. So we are all believers, and we all believe, we also believe in science. So our discussion is going to be based on both. As a believer and as a person who believes in science, how do you balance the two?
Yes. This is our outline for today. All right. And the first thing we're going to talk about is understanding stroke. Understanding stroke.
Then we continue with hospital care for stroke. What are the things that is done right away if you are having a stroke, or if you see your loved one having this symptoms? What are the things that you have to do, or what did they do when they take you to the hospital?
All right. And then after that, we are going to go to the next one, which is the role of prayer and faith. The role of prayer and faith. Is there even a role for prayer and faith when you come to certain severe and serious diseases? In fact, for diseases in general, but especially when you have a stroke or cardiovascular issue, what's the role of prayer and faith in there? Is there any? And we will want you to have your own answers and bring them, because we want to have a fruitful discussion.
And now we will talk about the take-home message. So between hospital and faith, what are our insights or our thoughts as believers and as healthcare professionals?
All right. So that's about almost everything, and then we allow you to bring your comments and your questions. And as a matter of fact, you don't have to wait to the end to bring your comments. You can bring your comments on the live, and the good thing is that we will see them. Just like our brother Richard helped us out to tell us that the audio wasn't working, we will see it if you are watching from any of the sources that we sent the message, except for LinkedIn. I may not see LinkedIn, but we will see everything from YouTube and Facebook. All right. So with that being said, we can move forward then. And the next thing that we're going to talk about, as our outline said, is understanding stroke. What is stroke in the first place? When we talk about stroke, what do we mean?
So stroke occurs when blood flow to the parts of the brain cells is interrupted, or is blocked, or is reduced. So it prevents the flow of that oxygen and blood to get, or the nutrients that the cells need to get it. So when it's interrupted or is blocked, that can be termed as stroke.
And the reason is because the cells will die. If your brain cells do not receive oxygenated blood and nutrients, within minutes, they will all die. And when they die, that is when functions to your body become inhibited, because your brain is a central control part in your body. If the brain cells begin to die because of lack of oxygen or because of lack of blood or nutrients, then they'll begin to die. And when they die, you cannot do some of the things that you usually could do. And that leads us to some of the signs and symptoms of stroke. You want to start with some of them?
Yes, so I think we have an acronym. If you want to go back to our first discussion of stroke, we came up with a word FAST, right? FAST. So F is facial drooping. So when your face droop, or one side of your body becomes so weak, you have difficulty lifting your arm and your face is down, you have slurred speech, and there is confusion, your vision is affected, and all that going on, then you know right away that you have to do something. The person or your loved one may be experiencing a stroke.
And then the arm weakness. So the FAST, the A also standing for the arm weakness. As a matter of fact, not just your arm, it could be your leg. So one side of your body may become weak as a result of an impending stroke or a stroke that is taking place. So that is another thing that shows up in a stroke. And then we said that the T stands for time to call, because a stroke or these symptoms are a sign of an emergency. And so we want to make sure that if you are seeing any of these things, time to call for the emergency services right away. Now, we are saying this because we're going to talk about whether or not you should go to the hospital, but this is what medically we say. If you see these symptoms, especially when they are sudden, when they are of sudden onset, that's very important because you can see some of these things in your life, but it may be something that has occurred slowly. It may not be from a stroke, but if it is of sudden onset, it just happened one time, all these things are coming together, then you know that it's an emergency. You have to do something about it. And the two things you have to do, there are two options you have. It's either to go to the clinic, to the hospital, or to go to a prayer camp. Or you can wait until you become paralyzed at some point, or if you don't die, then they may carry you to either the hospital or to a prayer center. But we're going to talk more about that and as we go forward. But before we do that, we can talk about some of the statistics, some of the things that stroke is doing. You want to start with that?
Yes, so with the T, I think last time we mentioned that time is life. So if you see your life once experiencing these things, it means that you have to act right away. So we encourage people to call 911 if the service is available, to rush their loved ones to the hospital right away.
Depending on where you are.
Where you want to take your loved ones to,
right? Right. Depending on whether you're bringing them to the emergency place or to a prayer center. But we will find out what you have to do. As a matter of fact, we will say that you take them to the emergency place. But apart from that, it depends on where you are. It may not be 911, maybe 999, depending on your country. In the US, it's 911. But in other places, it's your own different kind of number that you have to remember to call, or to just get ambulance and take you or the person that you're observing straight to the hospital. But we'll talk about whether or not that's the right thing to do as we go forward. So let's hit the statistics with stroke now.
Yeah, so approximately in the whole world, they took the statistics and realized that it's the second leading cause of death and a major cause of disability, affecting millions of people each year. So it's the second leading cause of death. So stroke is very rampant and is almost all over. I'm sure you may have a loved one that has experienced stroke, or you've heard of somebody that has stroke. And I think in the United States, we have almost 800,000 people experiencing stroke every year, and 140,000 people dying of stroke.
Around 40,000 deaths in a year, just in the US alone. And I think worldwide, it's even worse, right? Worldwide, it's even worse. If you think about the whole world, it's this, like she said, it's the second leading cause, the number 2 leading cause of death in the world. So whatever part of the world we are watching this from, it could be the number 2. And so you got to take care of these signs and symptoms that we talked about and act accordingly. But the key thing is, do you take the people to a prayer center or to the medical facility? So we're going to be looking into that. Now, with that being said, I think we can go for it, right? So the types of stroke, two different kinds of stroke quickly before we move on to the main topic.
Yeah, we have the ischemic stroke and we have the hemorrhagic stroke. So ischemic is just the blockage of the arteries in your brain. So if it's blocked, it becomes ischemic, right?
You don't have blood supply
to the cells, and the cells end up dying. Then that's the blockage. That's the ischemic stroke. And we have the hemorrhagic stroke, which there is bleeding. There is bleeding in the brain, or the arteries burst open and blood leak out and cause the cells to die in the brain. That would be termed as hemorrhagic stroke.
And again, immediate medical intervention is crucial for improving outcomes and reducing long-term disability. So if you ever had or see any of those signs, sudden onset of weakness in the arm or legs, facial drooping, and any of those other signs, confusion, slurred speech, you can't speak, whether it's you or somebody that you are living with, you have to take care of them as soon as possible to prevent either death or severe and long-term disability. So that is the summary what stroke is. Now we're going to go to the main topic. So we're going to be talking about hospital care and also prayer centers or prayer care, and see which one we should be leaning on, or what you think we should be doing. And again, if you have any comments, make sure you don't hold them, bring them as we move forward, because we are hearing stories, and we'll get to what we think. But definitely, let's move on to the next one, which is hospital care. Is what I think we are going to do. Hospital care, and we want to start off.
Go ahead.
All right. So for hospital care, we want to say that, because of the nature of the urgency of stroke, when you bring somebody who has a stroke, or for that matter any disease such as a stroke or even a heart attack, if you bring them to a hospital setting or medical facility, you are going to help them to basically diagnose the person quickly. Just because you brought them using CAT scans and MRIs, they can determine what kind of stroke is going on, whether it's a ischemic stroke that we talked about, or whether it's a hemorrhagic stroke, a bleeding stroke, or a blockade. Hospitals will be able to determine that. Now, a prayer center is not equipped to tell what kind of stroke you are getting, but we'll go to what they also do. And then you want to take the next one?
Continue.
Yeah. And the next one is, in a hospital setting, you can also have administration of emergent medications that you need right away. Remember, Gifty said that in stroke, what we really, really, really hammer on is time to go for help. Now, if you are able to bring the person who is getting stroke to the hospital as soon as you find out, they are able to use medications, well, a group of medications we call thrombolytics or TPA, to dissolve the clot, which would be causing the damage in the brain. So if you find out, oh, this person is getting a slurred speech, this person's face is drooping, this person is tipping on their feet, they can't stand right, or they are confused, they can't speak, and you bring them quickly, they can find out, apart from being able to diagnose what kind of stroke they are getting, they can also be able to dissolve the clot right away. And so you will be saving either yourself or the person you brought. And so that is how important hospital care is for stroke. Now, I don't know if you want to add anything to that.
Yeah, and sometimes too, if the blockage is huge, they will end up doing surgery right away to get rid of the clots or whatever the blockage is. They will just go in, open you up, and take the clot out. So that definitely save a lot of harm later in life, because they catch it right on time to get rid of the blockage.
Definitely. So that is the key hospital care, or the key thing that would make somebody required, I should say, somebody needed to see to a clinician or go to the hospital because they have a stroke. Now, another thing that hospital care may help is if the kind of stroke they determine is not a blockage and it's a hemorrhagic stroke, they can also control the bleeding in the brain using medications and other things, including reducing their blood pressures and stuff, so that the person may not continue to bleed profusely in the brain and cause more harm. And so hospital care using all these tools will be very good for a person who is getting a stroke. And there's more.
Yeah. So, and also that we know that sometimes the first time may be a minor stroke. That's a mild stroke. If you don't really take care of it, it can lead to a major stroke that can strike you dead right away. So going to the hospital is very important, because you're going to monitor the vital signs, the symptoms, your blood pressure, your cholesterol, and all that, and really help you tame it, help control the situation before it gets to the point that it can harm you, paralyze you completely. So just that they are taking care of whatever is happening to you, they're going to continue your care, so that there is a continuous care. They will make sure that they will check to make sure that your blood pressure is on point. They will give you medication so that you continue to heal or continue to control all these underlying conditions, so that you don't end up getting the massive stroke.
Good. And then also, with that being said, in a hospital, you may be admitted, Some people, I mean, some of these things, especially if you just got the stroke or if you just got hit with a heart disease, whatever it is, initially they may have to admit you in a hospital. Now, it is your choice to stay in a hospital, or as some people do, maybe your choice to check yourself out and go to a prayer camp or a prayer center. And that's the focus of our discussion. So which ones do you do? Do you stay in a hospital for to receive the care, or do you check yourself out and go to hospital? For some people, because they may have received severe damage already, maybe they cannot walk like a lady we are showing, and they cannot even think about the things to do themselves because the stroke has affected their cognition. People who are caring for them may make the decision, let's bring them to this prayer center. This pastor, this prophet, this priest, this person is a healer, tatahui healer. They will make sure that this disease goes away, and they may not make you stay in the hospital for treatment. So that is one thing that some people may do because of their prayer, and they believe in the healing hands of God, which is prayer and faith. So we are going to using that. I think we can transition into what prayer and faith also does. Is it bad, or is it something that we can also encourage people to do? So that would be, unless you want to add anything
Yeah,
to that.
and with the hospital setting, after you've been there, I think when they want to discharge you, after they've tamed everything down, they've taken care of you, and maybe you are paralyzed or you cannot walk or your speech is slurred, they may transfer you or may direct you to go to rehab, right? Rehabilitation center, and they will continue the care. So there's a process that they go through. They are not just going to discharge you if you have disabilities. They will try and continue the care as you leave the hospital so that other people can help in. We have physical therapists coming in, the physio, and other people coming in to help you recover. So there is a continuous care after the basic one has been taken care of.
My goodness, that's a very, very important thing there. Continuous care after a stroke, or for that matter, any other disease that you may be dealing with. We're using stroke because we just talked about stroke in the past few weeks. So, hospital care or medical care will ensure that you get a continuous care. Sometimes you may even be discharged, but they will make you come back for follow up just to make sure that things are going well. And so that is what hospital care does for, just to summarize it. Now let's go to the elephant in the room, prayer centers and and faith, right? That is something that we also need to talk about. And we, like you said, we are people of faith. So how are we going to handle this one? Because some people are also using only this one as a means of taking care of themselves. Any medical condition, they rely on prayer and faith, and um, some people do the other ones too. But let's see the importance of prayer and faith, and then we will come back and see how we can strike a balance for them. So you understand?
Yeah, so as we all know, as people of faith, we get a lot of comfort, a lot of assurance by believing and trusting in God. So prayer definitely provide what emotional and spiritual support to patients and their families. So if you are sick or a family member is sick or you've been stricken with weird disease or any condition, the first thing that you have to do as a Christian is to pray, right? And profess your faith and quote the word and depend on it and pray. So it definitely helps emotionally and spiritually to you as the patient and the family and the people around you, that they have rest assured that everything is going to be okay. So that support is definitely available if you depend on prayer and faith.
So you're talking about spiritual comfort and to patients and their families,
Right.
the support through prayer and faith. I will also add that prayer and faith can enhance a patient's mental well-being and reduce stress. Reduce stress. If you know that you have a God you pray to, I'm pretty sure you are going to be less stressed compared to somebody whose only hope is in medicine. They have nothing else except to believe the doctors. But if you are a man or woman of faith, you know, it doesn't matter if it's any religion, but we being Christians we say as a Christian. But even if you're not a Christian, whatever religion you have, if you have that belief that there is another person you can talk to and believe in, your stress levels become less compared to somebody who only depends on medicine. And so prayer and faith have, their own benefit, definitely, and a fastest positive outlook. If you have faith and if you pray, you can see the end of the disease before you actually get it healed. You get a healing because the faith will teach you that look out at the end and see yourself healed, and that will actually help you reduce your stress, and it will foster some positive attitude, and which can actually be beneficial and help with recovery, right?
Yeah. And also, we know that, like, if you pray, that sense of peace, you have this hope in your faith that will motivate you to seek help and to follow the direction of your providers, because you have this hope that is going to be okay. And because of the hope you have, you tend to follow direction. And like you said, it reduces your anxiety and your worries.
Definitely, definitely, definitely. So because you have the hope, it reduces your anxiety. And the key thing that you said that I want to emphasize is that if you have faith and you pray, it makes you adhere to your medical treatment and also your rehabilitation programs. If you believe that you're going to be well because you have faith, it should make you take your medicines. But the opposite is true also, right?
Right.
And the opposite could be true. Some people too may say it in the extreme that because they have faith, they don't believe in medicine. So this is a balance here. But we're going to be talking about the balance as we move forward. But definitely, that is something that can happen. Having faith and praying can motivate somebody to adhere or be compliant with their medical treatments and rehabilitation programs. Somebody who does not pray or does not believe in any God may say that, oh, this thing is not going to work, and then they may just relax and die or not follow through with their treatment. So faith can help you to do those things. And as a matter of fact, there's a word in scripture that says that faith without works is what? It's dead. And so if you have faith and you believe in prayer, that should help you actually to follow through your doctor's appointments and take your medicine, because that is the work part that you're doing. The faith part is trusting God to bring the healing. But the work part is you following through with your physical therapy, your medications, and your checkups and admissions and whatever else that you have to do. So that's huge for people who have prayer and faith as a source of healing in whatever is stroke or whatever disease. But then again, I say some people also have the extreme. They say that no, because I believe in God, I'm not going to take medicines. I'm not going to go to this doctor. I'm not going to do this program. I'm just going to a prayer center or a prayer camp and ensure that I'm doing well because God will heal me. So that's the balance there. But as we go forward, we're going to tell you what we think, and I'm pretty sure you also have some ideas that you can share with us on the live. So keep those coming as we move forward. All right. So the next thing that prayer does, you want to go?
Yeah. And if you belong to a church or you belong to a group, spiritual group, and you encounter any problem, by sharing that problem with the community or with your church, it gives you that sense of belonging, that sense of community and connection. Or that you're doing that, you have people backing you in that situation, meaning that you are not just a loner, one person in trouble. You have a whole community that are in with you, and they are supporting you, and they are connecting with you. Some people will call you, check on you, pray with you, visit you. That community help you to recover quickly. So belonging to a group like this definitely foster and help with your healing process.
My goodness, that's what's up. That's what's up. All right. So with that, we are going to move forward. There's more benefits, but there's a caveat too, as I already alluded to, that some people say that this is only the thing I'm going to do. I'm not going to do the other thing. And that is where the problem comes. So, while not a substitute for medical intervention, prayer and faith can complement traditional stroke care by addressing the holistic needs of patients. And you can put that there for any disease for that matter. We're using stroke as a point of call, but it could be any disease. So, while it is not a substitute, the key prayer and faith can complement, is a complementary thing, traditional stroke care or traditional healing medical care by addressing the holistic needs of all patients. We already alluded to the fact that you can have good mental health, you can have all the other benefits that you can, even helping you to take your medications. And that is what prayer and faith can do. So now, before we come to our own idea about what you should do, we are telling you, we already spoke about the fact that medical care is good. And then we talked to you also about the fact that prayer and faith is good. So where do you stand? Go to prayer camp for healing, or seek, medical care, or do both. We are going to go to that. But in order to make it complete, we also went through some studies. There are some studies that actually support prayer and faith as part of a healing process. So we're going to go through a few of them, and then we will go to the place where we think it should be. All right. So
Yeah, so according to our Journal of Religion and Health, it has been noted that individuals who engage in regular spiritual activities or practices like prayer, fasting, believing, hoping, they often experience what? Lower level of stress and anxiety, which positively affects their health overall. So there has been a study. There has something that has
several
been
studies.
several studies. Yeah, it's been documented that, and it's been proven that people with faith tend to recover quicker than people who do not believe in anything. The reason being that you are not anxious, because what the Bible says that we shouldn't be anxious over anything, right? In all things, with prayer and supplication, we should let our requests be known to God. So, because of that, as a believer, it's been noted that when you find yourself sick or a disease strike you, because of your faith, you tend to be more relaxed than somebody who do not believe in anything.
As somebody who does not believe in anything. Now, another study is also saying that improved coping and resilience is something that happens with people of faith. And that's a study from the Journal of the American Heart Association, a reputable one, right? It's saying that when you have faith, or people of faith and prayer, they have improved coping and resilience. They are better able to stand up to any disease situation, whether it's a stroke, cancer, whatever it is, because of their faith and prayer. They have more resilience, they have more ability to cope with the situation and deal with it without giving up that quick, unlike other people who don't have any such a hope or faith. And so they found that survivors who actively practice their faith report better coping mechanisms and greater sense of resilience during the rehabilitation process in stroke, and of course in any other disease. You want to
And
talk
I think I mentioned this part already, social support and community.
That's a
So
study proven too, right?
yeah, so studies have highlighted that involvement of religious community provides significant social support, which can be crucial in patients recovering from health diseases. So when you're sick, you need community support. And if you belong to a religious group, it's likely that you're going to get that support.
It's likely that you are going to get that support. All right. So, with that being said, I think then that's enough of studies. I think we have already exhausted most of, and we have more studies that we could talk about. But in the interest of time, we are not going to be talking about studies. We're just going to now go to the part where we talk about what we think, about what we say, faith and prayer, striking the balance. Faith and prayer as well as seeking medical care. Now, this topic came about. Let's be a little realistic. This topic came about, and the reason why we chose this topic is that we have heard stories of people, including great people, men of God, singers. I mean, some of the examples. I don't know if we have permission to mention names. You know, trending in social media, in places that we know that are not seeking medical care. Are not seeking medical care. They are actually in prayer camps, what we call prayer camps or prayer centers, and they have actually stopped everything else, just using prayer to solve an issue which may be a medical issue. So that is something that is happening. And that is why we chose this topic, because much as we believe in prayer, we believe that there has to be a balance. And so that is where we are coming from. So I wonder what you guys think about this. If you're a person of faith, should you at any point neglect or completely forego whatever it is that the medical community can do for you, and go strictly because of your faith to a prayer center, just to pray for healing? Or should you do both? Or should you even forget about prayer and also just do the medical one? So that is the question for you. We want to see, if you are watching, if you watch later, what would be your answer before we proceed with our own ideas on how to strike a balance.
Yeah, so I think sometimes people are not sure because if they tend to seek medical help or they tend to depend so much on the hospital, they feel a little like judge people will judge them that maybe their faith is not all up there, so sometimes people expect you as a Christian to depend, which we encourage all Christians to do, to depend solely on God for everything. But at the same time, I think we should also believe that God sometimes use people to help us. He wouldn't come down to uh he uses people, you know he uses people. So we should understand that it's okay for you to seek medical help as a Christian. That doesn't mean that your faith is not up there or your faith is not all high there. Some people have this faith, and sometimes when you listen to the preachers, sometimes they say certain things that you tend to wonder, do I really fully trust God in this condition? So we are here to encourage you that there should be a balance between the two. You can seek medical help and you can also enjoy your community. You can also practice your faith. You can also keep hoping in God that at the end of it all, healing will ultimately come from God. But it doesn't mean that you should sit down and fold your arm. Like you said, faith without works is dead. So if you have faith in God, there is something that you have to do. You have to seek help from the medical center. And I think with this discussion, it will lead to the point as why some people don't really will choose one over the other. I think we are concluding that you have to strike a balance, meaning that we believe in both seeking medical help and also seeking God for your healing. But why is it that some people would choose one over the other? I think that can be another discussion,
That's
right?
a good question. Let's go through some of them quickly. I think we wrote some of them down. One of them is distrust of the medical profession. Some people would not seek medical care because they do not trust the doctors, they do not trust the healthcare system in the first place. They think that they don't know what you're doing, or they think they're going to be discriminated against, or they think that it doesn't work. Whether they know what they're doing or not, it doesn't work. And for that reason, some people say that, you know what, I would rather go to a prayer camp or prayer center and just seek for care over there, no matter what disease it is. So some people do that for that reason.
Yeah, and sometimes it's not just the distrust. Sometimes it's just that because they don't really understand what is going on in their body. So they are taking it lightly to do something else. Like what we discussed about stroke. If somebody is having stroke, the urgency of taking the person to the hospital. So if you understand the way whatever is happening in your body, the urgency that you have to seek help, you don't wait for it to strike you to the point that you are so paralyzed. Then you are going to God for healing. So why don't you act right away, seek help, and alongside pray that God will come through for you. So it's understanding the situation. Like when we talk about high blood pressure, we talk about diabetes. We encourage people to eat right, make the right choices, exercise, So if we are encouraging, if we understand how blood pressure affects our organs, maybe we will do things differently. So it's more about understanding the conditions so that we will make the right choices. So if we understand that if we don't control our blood pressure, it's going to lead to stroke. If we don't control the diabetes, it's going to lead to that. Then we do things anyhow. We come out of ignorance and act anyhow because of our misunderstanding. But if we understand the conditions, it will tend us to trust the health system more.
All right, that's a good one. If you do not understand it, you'll make up excuses. You make up excuses and say that it doesn't work, or I will not use it, or whatever it is. So the key is to know what you are going through. And sometimes you may not know. So what you got to do is to just believe the system and go anyway. I mean, I'm going to say that. Just trust the system.
Trust the system.
Trust the system.
Yeah, just like coming out ignorantly saying that I haven't been to the doctor
Yeah, for years and
for
I'm
years
not
and
sick.
I'm okay.
And
You
you
are
are
coming
happy.
out of
And you're
ignorance.
saying it proud, which you should be shy about. But people say it, very proud. As for me, I don't get sick. You don't get acutely sick, but chronically, there's something going on. And so you don't say that and be happy. You got to be checked out at least once a year. And so similarly, if you do not know what is going on in your body, you will take everything to prayer camps. Some things will be solved just by going to the clinic the first time, but we complicate issues because we think that only prayer should be used. So the first reason is that distrust, and potentially we could add number two as ignorance or lack of knowledge about disease situation. I think there's more. We wrote another one down.
Yeah, extreme faith,
We,
belief.
oh my goodness, we have people who also have too much faith. I don't know if
Is it okay
there's I don't
to
know if
have
there is
too much
too
faith?
much faith, but in
Extreme.
this case, that's a extreme, and to the point of becoming fanatical about it. Everything is prayer. They are shaking your hand and they are praying. How you doing, and they answer you with prayer. I know you pray. I know you pray, but there's time for everything. The Bible says that there are seasons for everything. And I think when we were talking about this, something came up. We said that people have faith, and because of their faith, they want to do certain things to show that they have faith, and that if they don't do certain things, it shows that they don't have faith. No, that is wrong, because we are physical beings as much as we are spiritual beings. And so I think we remember what we said about when God tells us in Scripture that, hey, I'm going to provide and supply all your needs according to my riches and glory. That's what Scripture says. But as of now, I haven't seen God bring me my car from heaven. I still have to work to make money to get a car. I still have to work to make money to pay my mortgage. So, yes, He is supplying it, but I had to do the physical portion of what it takes to get it. So, whatever I have, I attribute it to the fact that God gave it to me. But I didn't stay home and say that God said He will supply. And because God said He will supply, I'm not doing it. I'm going to just pray all day, pray all week. That is false teaching. In the same way, if God says that He is going to heal you, He doesn't say don't seek professional help. He doesn't say don't seek a doctor's help, or don't take your medication, or refuse to agree with any of the things that physicians and nurses are saying or pharmacists are saying. He doesn't say that. He actually encourages you to do those so that will complement what He is doing, because He is not supplying manna like He did in the past. He supplies it, but you have to work for it. You have to go and show your faith through your works. And so that is one thing that we also have to add. So if your faith is too much, that's what I would call it, extreme, then you are misapplying scripture. No matter what religion you are in, it could be an Islamic person, it could be a Christian, whatever it is. If you are watching today and your faith tells you don't seek help from the doctors, or other people are taking you to a place for prayer because of your disease state, and you cannot be brought to a clinic, or you're not taken to a medical facility for checkup and for treatment, then there's an extreme case there. Because praying and seeking clinical or medical help is not in a disagreement. It agrees. Just like God promising you that He will give you all the riches, and yet you still have to work. He doesn't. And my wife said, you said something that is even funny. You remember what you said? You said that even food, even after God gives you the food to eat, you still have to cook it. Oh, come on, man. You still have to cook your food. You can't say that God had given me the food. He's going to cook the food and put it in my mouth. It doesn't work like that. So extremes of faith is what we are talking about. It is good to have faith. And trust me, I want my faith to multiply. But I also don't want to go to the extent where I do not believe in the things that God Himself has set in place for me on earth. You are not living in heaven, you are on earth. So do the things that are earthly also, much as you are a spiritual being on earth. Come on, man, I think I like that. All right.
Yeah.
And so that is one aspect of it.
And another one too is like, if you are extremist, right, you make some empty declarations. You know, like the things that you're saying has no basis, but you just want to show off that you have faith. So let's say, for instance, you've gone to the hospital as a pregnant woman, you know, the doctors have done the ultrasound and it came up like you have a breech baby, meaning that the baby has turned upside down, right? So you're not going to have a regular delivery, and you come and say that I'm going to give birth. You know, that's like a empty declaration. Yes, you are going to give birth, but on what basis? You know, we know someone that have challenged us and the person died. You know, that's empty declaration. You know, so trust in God, believe that God is going to redeem you, but at the same time, you have to listen to the medical professionals so they can see in you and they have access to that, and they are telling you that your baby is breached. You know, so even if you have faith, it's okay. You are going to pray for God to change the situation. You've prayed for 2 weeks. The best thing that you can do is to go back and do the ultrasound, and their doctors will say that, oh, the baby has turned. Then you can go with the regular way. But if you are going to challenge this, you may lose your life. So we don't want to miss the two. We talked about the benefits of having faith. You know, we talked about the benefits of using. So balance it. Use the two. One doesn't substitute the other. It complements the
Complementary,
other.
yeah.
It complements the other. So with those two, you're going to live a healthy life and a wonderful life that everybody around you will enjoy. But to make empty declaration and put all your loved ones in problem, then that is really a bad choice to make.
Definitely. That is not good. Now we have a couple of comments too. We have Favor Champon says definitely both. Definitely both. And we could not agree any more than that. Come on, man. Definitely use both. You cannot take one over the other. And we're going to talk about another reason why some people do that. But before that, I think brother also said something here. Brother Ben says that Madame has said it all. Oh, come on, man. You have said it all. My goodness. But there's more to say. So hang out here. Let's continue. There's more. Yes. What is the next thing?
Yeah, and I think
reason?
other reasons why people would choose one and not the other will be financial difficulty.
Financial difficulty. Financial difficulty. You can explain a little
Yeah,
bit.
so like if they don't have health insurance, maybe after the doctors have done the first part, the next part is for them to go to rehab or try and find a physical therapist, but they don't have the means. Then the only choice is for them to find themselves in the prayer center. And sometimes we have some pastors that are really taking advantage of such people. So I don't know, there should be other way that you can seek help. In addition to praying, you can still try. So I don't know, if you don't have the means to keep staying in the hospital, what else can you do? That's when you have family and community coming in to give the support.
And that's when the church should also come in.
Yeah.
Rather than to take you in and make you lose your treatment, the church you belong to should be able to organize and say that, hey, this person is going through this treatment and they cannot afford, there's no insurance, let's mobilize and help. Rather than to take you into their center and use prayer for something that requires, say, surgery or therapy or medications or whatever it is, that is not showing love. I mean, you are showing love in the wrong way by just keeping them and praying and praying and praying. But the best would have been potentially organize a service and raise funds and use it to support this person for the treatment that the physicians have determined to be appropriate for this person.
And providing the financial means, you can stay in your church or the community can come together and pray to support the person.
Yes.
That will be a balance between the two than to ward the people into the prayer centers and just tell them stories with nothing backing it and just keep them hoping. Meanwhile, there are resources available for them to enjoy in addition to the prayer. Then you are making it only one-sided. There should be a balance between the two.
There should be a balance between the two. And that's a very good point. Especially if you have to be admitted to the hospital and people really want to take you to the prayer centers, those people should go to the prayer camp and you stay at the hospital and you pray and you receive those people who want to bring you there, they should rather go and pray and then you stay at the clinic and receive treatment, because the prayer will work in the hospital for you. So you don't have to completely avoid seeking help at the hospital or clinic and go to the prayer camp just because that is where you belong to, or that is the people you love, or whatever it is. And especially if it's financial issues, there's got to be a way of doing it. And I think the communities must come together and raise funds to help people that way, rather than to have people lose their life and then we make big ceremonies and contribute, to them. When they are sick, either the people don't ask or we know but nobody asks to help. This is where we have to also change as a community to help people recover, help people, support them while they are alive, rather than to wait until they pass and then help out. So that is another thing that community can help. And so what is the other reason why people get in prayer camps? I'll bring another one. The other one is pressures. Family and societal pressures. Somebody will come and tell you anecdotally that, hey, I had this issue, and when I went to this minister, this prophet, this pastor, it went away. Oh, come on, man. And it is true, it went away. It doesn't mean yours will go away when you go there straight up. And so it is better to seek all the avenues. What we are saying is do both. So don't get us wrong. I preach. I am a preacher. So I'm never going to tell you don't pray. I pray and I want you to pray. But I don't want you to neglect seeking professional care just because you believe in God. That is what we are against. We want to strike the balance, because that's what God wants. He wants a balance. Even his word says that there's got to be a balance. Do the praying when you are sick. If you cannot pray and some people have to pray for you, you don't have to sleep there at the camp. Let the people pray while you are seeking care in the hospital, because that is where is a specialized place where physically you are being treated. So the prayer can work from home, it can work from the prayer camp, but you don't have to stay at the prayer camp. You got to seek the help. That is what exactly that I think. And brother Richard is laughing. I don't know. I think he got my point. All right. Is there anything else that we?
Yeah, I think hearsay. I think you mentioned that. Like you hear. So when you are sick, everybody around you would like to,
Offer
give you offer help
Advice.
and advice. Everybody will telling you this, do this, or this one, if you stay in this country, you're going to die. You have to go back home and seek help. Other people will come and tell you, oh no, I know of this person. Oh no, I know of this fetish somewhere. Like a lot of information be coming to you. So it's more like hearsay. And oh, this medication, if you take it, this condition, there is no way that the secular or the conventional medicine will help. So you have to drop everything and go for the natural or traditional treatment. So you can see that a lot of people will be giving you ideas, and everybody tend to be an expert, except you that you are sick. Everybody's giving you ideas. So what we are here as healthcare professionals, we're encouraging you is that seek God and also seek
Care from
care
medical.
from medical setting. Don't do one over the other. So like when I was growing up, what I was told is like seek God like you don't have any help coming from anywhere. So you pray, you submit your petition, you cry unto God like you have not sought help from anywhere. Then you go to the medical center, you go see your doctor, ask the questions, seek help in the medical sector. If the diagnosis that they're giving you is not like a coherent, or you don't really get it or understand, go for a second opinion, a second doctor. Go somewhere else and get that information. So you were seeking help in the medical sector, and you are also seeking God religiously. Then you combine the two, and you are definitely going to get your healing. Or even if you don't get your healing, you get your peace of mind. You'll be at peace than to be all over. Your condition is such that this person comes and tell you, oh, conventional medicine doesn't work. You drop everything, then you go prayer, then you pray, then you stay in the prayer center.
Not to cut you short, but
Yeah.
to also interject, some people too, you are doing regular conventional medicine, and people will bring you herbals and say that use this herbals. This is what this person took and they got better, or this is what I took and I got better. That is not true. I mean, they may have gotten better with that. It does not mean that you taking the same thing would help. And so being focused at your care is better, and being, making sure that you are using both of your advantages. The advantage of faith, you got to use it to the max. Like she said, pray like you have no other medicine to take. Use it to the max. And then when you seek doctors, even if they are giving you bad diagnosis or terminal diagnosis, seek second opinion like you also have no other help. Just combine the two and ensure you benefit from them both, because that's how you win, rather than to just completely block one and say that, okay, if the doctors are saying that I'm not going to get better, then I'm going to just go to prayer camp. They may not be the final say. Seek a different doctor's help and seek treatment through other place. And then also at the same time, I'm not saying leave prayer, while prayer is your backbone. So you got to put those two together and make sure you get the benefit of both, rather than to just stick to one. So there are several other reasons why people, people do not seek medical care for diseases, including stroke. And we have heard stories. I heard stories. I actually heard a story on, I think it was on Facebook. I saw a young guy who had a kidney issue was taken to a prayer camp, and the person ended up dying because the first time they went, they got better, and so they really believed that prayer would do it. And then the second time it came, they brought them to prayer camp again, and this young kid who could have easily survived, with simple medical interventions, stayed there until they died. This is happening in several places. And so why would you do that when you have the benefit of both? You don't have to stay there for the prayer to work. You can come home or see the doctors and let your mom or your people who want to send you, they tell them, you go stay there and pray for me. And then I'll go to the doctors while I take the medicine and the procedures, so that you get the benefit of both. The key is strike the balance.
Right.
Use both. You do not do just one. Right? All right. And I think I have another comments by Brother Boateng saying that God bless you for this topic. People choose prayer over the hospital. Brother, I couldn't agree with him. And I understand that sometimes the men of God also make it that way. They do not encourage people. Because if you came to me as an elder of the church and you told me your problem, whatever it is, even if God reveals to me that some spirit is doing you, even if God did that, the spirit is not doing you spiritually, because the thing is manifesting physically. So they are doing it spiritually there, but I'm seeing it physically. I'll tell you to seek the physical help while I also pray for the spiritual help. You know, as long as we are spiritual and physical beings, we got to use both attempt to, to fight anything that we face. And as a matter of fact, it's not just for diseases, for any issues, whether it's marital issues, whatever it is, if you believe spiritually something is happening, do the spiritual, but also make sure you do the physical. For example, if you're a married woman, and not to drag matters, but if you're a married woman and your husband is, trying to do certain things you don't like, and somebody tells you that you got to go somewhere, you got to, when they say you got to go somewhere, this woman that your husband has seen is using juju to steal your husband or doing something to steal your husband. You got to find somewhere. You got to go somewhere. They will tell you to do that. Good. Go somewhere. Go and pray. Go and do your prayer. But the physical thing you do is, what have I done to make this man not like me or love me anymore? Maybe you are dressing shabbily. When they met, when you guys were together, initially you were dressing nicely and everything. Now you want the man already, and so dressing is basa. You are not putting up anything. You are not showing the man any affection. You are even insulting them at home, and so they feel disrespected. And they are looking out, and now you blame the spiritual only. No, blame spiritual, but also check the physical. That is how we have to approach our life. Every aspect, because we are both, you attempt to fight everything off at both spiritual, physical, spiritual, physical. You don't only dwell on the spiritual and let things happen, bad in the physical. So,
but we keep hearing some people also preaching on Facebook that there are some diseases or some conditions that are spiritual diseases, or somebody bought it for you.
I heard that before.
So like HIV, they will be like, oh, this one somebody bought it for you. Diabetes, oh,
No, they say they have it. They say they are bonidia. I don't know how they say a curse.
a curse.
Yes, that's
okay,
what they will
you've
say.
been cursed, or maybe they bought it for you spiritually, and
Diabetes,
that's why it's been transferred to you.
Yes.
That is a lie. But you can hear people saying it, and they will add that such diseases you can seek physical or medical help, and it will never go away.
That's what they will tell you, yeah.
Yeah, because it's a spiritual disease. So stuff like that, some cultural influences make us choose one over the other because of the lies that they keep selling to us, that this one is a spiritual disease. But it's manifested, like you said, in the physical. So it's no more spiritual, it's now physical. So seek the spiritual, the physical help and the spiritual help. Balance the two, because we are what? We are spiritual beings. At the same time, we have physical bodies.
Definitely. And I think this is a good thing to wrap up, unless you have anything else. So we think from now, and we are hoping that you are going to make the right decisions when it comes to your health. Do not stay home and blame spirits. Even if you blame them, you have a spiritual weapon. The Bible says that for the weapons of your warfare are not carnal, but they are mighty through God to pull down strongholds, right? So pray and come against the spiritual.
Yes.
But at the same time, if it's your blood pressure that is going up, you got to take a blood pressure medication, bro. You got to take that. If it is your diabetes, your blood sugar that's going up, like Gifty said, even if they bought it for you, you take the medication and watch it come down. Come on, man. Watch it come down. Do your exercise. Eat right. Lose that extra pound and see it come down. So let's approach issues. This is how many people have developed. This is how many nations have advanced. In fact, some of them have also gone the extreme by neglecting the spiritual part of our existence and just doing everything physical. But until you see problems as multifaceted, you do not solve them multifaceted. So if you see problems have roots in spirits, but they manifest in physical, you attack them both at the root and at the physical level. If you are building a bridge and there's a water place, a Western person, a Western engineer will come and do all the things that science will tell them. But somebody who is only spiritually in tuned would say that as for this, you have to
Do
you have to do
sacrifice.
sacrifice before your people don't die, and they may not do anything about science. And that kind of mentality has influenced a lot of people and causing people to take these decisions that you would naturally think that, oh, they got a stroke, it is a stroke, they got to get treatment. If they treat well, the stroke won't come back again. In fact, with good physical therapy, occupational therapy, they may be able to get some functions back, rather than to go and put that person in a spiritual camp and just pray and pray and pray and pray. You are doing that person more harm. So you go there, those of you who have been advising people, you go there and stay there for them and
And
let
pray.
them and pray for them. In fact, we believe that. Go there and represent them at the prayer camp or center, and then let them receive the necessary treatment so that the two shall agree. I don't know, but I think we should wrap up. Do you have anything else?
Yeah, so I think you touch on it a little bit. So like on the in the Western side too, they depend so much on the physical that everything you seek the medical care and they forget about the spiritual aspect. You can see the community more anxious. I don't know whether you've seen that. People are more stressed and people are more anxious because they've neglected the
Yes.
spiritual part. They depend so much or they believe so much in the medical sector that they will seek that. So when the diagnosis is bad, you know, they tend to panic and they tend to worry, and you can see the anxiety kicking in, the panic attack kicking in, because they depend so much on the physical, on the medical care.
So you
So
should say
there is
they
no
depend only
balance,
on that.
only on
Yeah.
that.
Yes.
So there is no balance. But we know that just one side doesn't overshadow the other, it complements the other. So I think that would be something that we can end with, that we can do both, we can complement each other. We are not going to neglect the other, and we will have a sense of well being, and we can really enjoy our lives and our health holistically,
Holistic
not
health.
just partially.
All right, that's a very good question. Now we are we are about to end the show. If you still have it, if you haven't asked anything and you have a question, you can still do that. And we also want to say that we coming back to the next week, we are going to go to every other week. We're going to do one health show. So if you have a question, you can still place your question in the comment. That's why I'm showing this Q&A while I talk. We're going to do every other week. We'll do one health show and one other show we'll call Whole Life Show, where that will be on any social issues, including finances and anything that is trending that we want to share too. Some people think that we don't have a say in some of the things. We talk about them at home too. Come on, man. And so we will use that other week to talk about social issues so that we will also
Help our
help
community.
help our community to make certain decisions that they have to. So one week would be just health, the other week social issues, finance issues, and stuff like that. But you would have to subscribe to our YouTube channel to get all the health videos that we have on our channel. Dr. Oteng, Droteng, is the YouTube channel for the health. And then if you also want to follow our social issues, that would be the Whole Life channel. Whole Life channel, one word. And that will also be, so you'd be youtube.com/at Whole Life channel. And the YouTube channel, youtube.com/Dr. Oteng, the @ sign. Those two channels are going to be where we're going to be operating at. But if you are on Facebook, you're going to see both shows coming your way every other Sunday, I should say, right? Every other Sunday. And with that being said, if you haven't subscribed yet, we are coming live on both channels now. I don't know where you are watching from, but you could definitely subscribe and ensure that whenever we post a video, like today, we posted a video at 3 p.m. And if you are not subscribed, you don't know what we talked about. We talked about very important, issues concerning the future of stroke treatment and stroke management. So if you subscribe, it will come to your feed, and then you will know what what I actually made a video about. So subscribe both to this channel at Dr. Oteng at DROTENG, and also the other social issues channel, which is Whole Life channel on YouTube. All right. In that case, I don't know if you have anything else to.
Let me scroll down one.
I think that's all the comments we have for today. Yes. So we want to thank especially Brother Richard for helping us out. We would have finished the whole show without audio, because our audio, for some reason, the device did not show the audio. But thanks for showing up and letting us know right off the bat so we could fix it before everyone.
And we also like the likes and the thumbs up and the stars and everything.
And everything that you have given us, all of you. And yeah, somebody gave us on Facebook, you can support us by sending stars so that we'll become stars someday. Come on. All right. So with that being said, again, if you haven't subscribed, please do subscribe and share so that we will share with most people. If you have any topic that you want us to talk about on a social issue, hot button issue, you can suggest it and we will take it on, and we will discuss it, because we want to make sure that our impact reaches farther, and you are part of the community. All right, so I think that is where we are, and without anything else we can say. Oh, we didn't introduce ourselves. I am Dr. Oteng, and my wife is
Dr. Gifty Oteng.
All right, and we are signing off today, and we will say, Beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching.
Thank you.
God bless.